and the pain just kept getting worse and worse.
It started as a simple stomach ache, but Alexandra Vari Papa, a student at the University of Richmond, decided to go to the emergency room. Here, doctors ordered a full CAT scan, a radiation imaging test, which found a harmless ovarian cyst. She never questioned the CAT scan.
I was pretty flabbergasted.
But her father did when he got this $8,500 bill, $6,500 of which was the CAT scan.
Look straight ahead.
Robert Vari Papa, himself a physician, says his daughter's pain could have been diagnosed far more easily and cheaply with a $1,400 ultrasound.
A history, a pelvic examination, and probably an ultrasound.
You just started with an ultrasound, not a CAT scan.
Yes.
I don't think that's fair.
The hospital defends the CAT scan, saying that an ultrasound might have missed something more serious.
It would not have ruled out appendicitis, obviously. It would not have ruled out necessarily a kidney stone.
Dr. Vari Papa agrees, but asks why not start simple and do the CAT scan only if necessary. What's your sense of what's really going on here?
Well, it's my opinion that this is defensive medicine.
Defensive medicine is usually what happens when doctors order too many tests because they're afraid of missing a diagnosis and losing a multi-million-dollar lawsuit for malpractice. Defensive medicine is pervasive and very expensive. It adds billions of dollars to the cost of health care every year.
Defensive medicine is indeed bad medicine.
Dr. Kevin Poe runs the popular medical blog, Kevin MD, where doctors routinely confess exactly how they run up costs by practicing defensive medicine. In this post, one ER doctor says he's just admitted 2 patients to the hospital when he was sure neither was having cardiac problems, but what am I to do? Another admits that in his practice, every patient with a headache gets a CAT scan.
It's much easier to defend the fact that you ordered a test than it is to not order a test at all.
And the costs of defensive medicine today are increasingly paid by patients, even those with insurance, because of rising deductibles and copayments.
There's no doubt in my mind that this is a significant driver in healthcare costs today.
But there are ways you, the patient, can sort out the necessary tests from the unnecessary tests. Experts tell CBS News you ask basic questions. First, why is this test needed? Ask about the cost and if there's a less expensive alternate test. Ask if the test results might change your diagnosis or treatment. And what is the risk if you don't have the test?
They didn't really talk to me about doing anything else.
In Alexandra's case, the hospital insists her CAT scan was medically required given her symptoms. But in the end, the hospital did present an $8,500 bill for a condition that went away on its own. Wyatt Andrews, CBS News, Richmond.